Hello, welcome to Chapter 7. Chapter 7 is about neoplasia or cancer. So, neoplasia means new growth. It implies abnormality of cell growth or a tumor. There are malignant neoplasia or benign neoplasia. So, malignant is considered cancer, whereas benign growth is generally easily cured. Malignant cancer may not be survivable. Some are, but then depending on the type, some are not survivable. So cancer is associated with an altered expression of cellular genes. So here are the differences between malignant and benign growth. So benign growth does not have a potential to kill the host, but it may be life-threatening because of its location. So just imagine if you have a mass, a benign tumor that grows in the head region, right? It causes intracranial pressure, therefore it can potentially kill you. Benign tumor does not invade adjacent tissue or spread to distant site. Many are encapsulated, more closely resemble original tissue type, and it grows more slowly, little vascularity, rarely necrotic, and often retain original function. Whereas malignant tumor, it can kill the host if untreated. It is confirmed by invasive or metastasizing nature. It is tissue specific differentiation, so it does not closely resemble the tissue type of origin. The greater degree of anaplasia means without growth or without differentiation. It indicates aggressive, more malignant. Growth grows rapidly. Malignant tumor grows rapidly, may initiate tumor vessel growth, and frequently necrotic and dysfunctional. So malignant tumors are classified by their tissue of origin. You have the epithelial tissue of origin that's considered carcinoma. If it's from a gland, then it's called an adenocarcinoma. If it's from connective tissue, muscle, or bone tissue, they have a sarcoma named after it. And if it is a brain tissue or spinal cord, it is called a glioma. When it's pigmented, then it is called a melanoma from plasma cell, which comes from beta or B lymphocyte, right? Those are called myeloma. Lymphatic tissue are called lymphoma. Leukocyte in origin, they are called leukemia, and erythrocyte is called the erythroleukemia. So the epidemiology and cancer factor, you have cancer is the second leading cause of death in the United States. Most cancer death occurs in individual that is over the age of 55. Men have about a 1 to 2 risk of developing, means 50% risk of developing cancer, whereas women have a slightly lower risk. The 5-year survival rate, well, depending on what type of cancer, is about 66%. One third of cancer-related death may be attributable to lifestyle factors such as tobacco use, nutrition, obesity, sun exposure, and all sexual exposure to human papillomavirus, HPV, which causes cervical cancer. And as you know, now we have the vaccination for that, which is called Gardasil. So early screening will help in early detection. So if you can detect it early, therefore, it is going to be easily treated. Cancer risk factors continue. So here we see that there are the rates of cancer and also the rates of death. So A is the rate of incidence of cancer, and B will be the incidence of death due to a certain cancer. So A states that for men has the highest chance of acquiring prostate cancer, or the number one cancer that plagues men are prostate cancer, followed by lung and bronchus cancer, and third will be the colorectal cancer, whereas women, breast cancer will be the highest incidence, followed by lungs and bronchus, and then by colorectal cancer. However, if you look at the B will show that the number one cause of death due to cancer in both men and women are lung and bronchus, followed by prostate in men and breast in women, and then you have the colorectal, which comes in third. So, tobacco use and how is that associated with death? So, the death rate from lung cancer has dramatically increased, and it may be directly related to smoking. So, lung cancer is the leading cause of death in men and women, and it has the worst survival rate. So, if you look at the graph below, you're going to see the largest, which is the lungs, followed by the esophageal for men, and it will be pancreas for women. So it is also linked with or to pancreatic, kidney, bladder, mouth, and esophageal and cervical cancer. So genetic mechanisms of cancer, first one are the agent that causes the cancer, which are called carcinogens. Then we have proto-oncogene, which is a gene that regulates, which turns on or off the production of cells or proteins, and which is a cancer critical gene that codes for growth factor, receptor, cytoplasmic signaling molecule, and also nuclear transcription factor. Then we have oncogenes, which are mutant proto-oncogene, and that is caused by radiation, virus, and etc. We also have in our body what is called a tumor suppressor gene, and these are genes that inhibit cell proliferation. And when cancer may arise when these tumor suppressor gene function is lost or they are inhibited. P53 gene is the most common tumor suppressor gene defect identified in cancer cell. So more than half of all the tumor that exists in our human body lacks a functional P53 gene. P53 gene inhibits cell cycling and it accumulates after cellular DNA damage. The binding of the gene to damaged DNA and stalls the division. It may direct cell to initiate apoptosis, which means that it's programmed cell death, and it allows genetically damaged or unstable cell to survive and therefore continue to replicate without this P53 gene. Chemotherapy and radiation, these treatment targets the cell and it triggers the P53 to initiate, and therefore it mediated cell death, or it will cause the cell to die. Cancer that lacks these functional P53 gene may be resistant to chemotherapy and or radiation. There are also other genes that is in our body. There are many, and one of the most common or most recognizable is the BRCA1 and BRCA2, and these two genes are associated with breast cancer. So if a person has this in their family history, and it could be inherited when there's a defect in the BRCA1, it increases their risk of breast cancer and also ovarian cancer. Metastasis is the term where the cancer cell escape their original tissue and invade new or initiate new colonies of cancer in distant site. It is specialized enzyme and receptor that enables them to escape their tissue of origin and metastasize. The cancer cell generally spread via circulatory or lymphatic system. The staging considers location and pattern of spread within the host. It considers the tumor size, extent of local growth, lymph node, and organ involvement, and distant metastasis. It is also known as the T, which is for tumor, N is for node, and M is for metastasis. And it is the most widely used staging system. The result of staging determines the treatment modality. Genesis. Angio means blood vessels. Genesis means growth or synthesis. It is the process by which cancer tumor form new blood vessel in order to grow, because these tumor cells, they're also a tissue, and tissue requires nutrients to grow. It usually does not develop until late stages of development. Triggers are not generally understood, and inhibition of angiogenesis is an important therapeutic goal. Effects of cancer on the body. So it depends on the location of tumor and extent of metastasis. Early stages may be asymptomatic. Tumor increases in size and spread. More symptoms become apparent. Pain is one of the most common and feared complications of tumor. It may be due to metastasis or tissue destruction and or inflammation. So it may be caused by cancer treatment itself, and it is usually controlled by medication which are called analgesics. Another effect of cancer on the body is called cachexia. Cachexia is muscle wasting, as you can see on the picture on the right. It is overall weight loss and generalized weakness. When it comes to weight loss of cancer patient, usually you're going to have a large amount of weight loss in a very short period of time. So it is due to loss of appetite or anorexia, increased metabolic rate, and or nausea and vomiting. The immune system is suppressed by cancer cell secretion, and some cancer can elude immune system detection. Bone marrow suppression contributes to anemia, leukopenia, and thrombocytopenia. So, leukopenia will then suppresses your immune system, thrombocytopenia, therefore it will suppress or it causes a deficiency in blood clotting. So, due to the invasion of and destruction of bone marrow cells, you have poor nutrition and chemotherapy. Anemia is deficiency in circulating red blood cell. Other effects include hair loss and mucositis. It is a complication of chemotherapy and radiation therapy. Mucositis, primarily source of cancer, pain, and also anorexia, and that provides a portal for infections as well. So you also have paraneoplastic syndrome, which includes hypercalcemia, Cushing's syndrome, secondary to ACTH, adrenocorticotropic hormone secretion, hyponatremia, and water overload secondary to excess ADH secretion. So the warning signs of cancer, you have caution, children. So caution, C stands for it's a change in bowel or bladder habit. A sore that does not heal even with treatment. You have unusual bleeding or discharge, thickening or lump in the breast or elsewhere, indigestion or difficulty swallowing, obvious change in warts or mole, nagging cough or hoarseness. Continue unexplained weight loss, headache with vomiting, especially in the morning. Increased swelling or persistent pain in bones or joint, lump or mass in the abdomen, neck, or elsewhere, development of whitish appearance in pupil of the eye, recurrent fever not caused by infection, excessive bleeding or bruising, and noticeable paleness or prolonged tiredness, which is a sign of anemia. Cancer therapy. Cancer therapy depends if it's early detection, which has the best prognosis for cure, because when there's an early detection, or when the cancer is detected early, it has not had the chance to metastasize. Therefore, the cure or the prognosis is much better. The mainstay of therapy includes surgery, radiation therapy, chemotherapy, and of course, drug therapy. There are emerging therapies which uses immunotherapy, targeted molecular therapy, stem cell transplantation. So, immunotherapy primarily involves interferon, interleukin, monoclonal antibodies, and it is generally used as an adjunct therapy, not a primary therapy, but an adjunct therapy to surgery, irradiation, and chemotherapy. So when you have interferon, which is a glycoprotein that is produced by your immune cell in response to viral infection, interleukin, which are peptides, which are shorter chain of amino acid than a protein. It is produced and secreted by white blood cell, and monoclonal antibody, which are antibody with identical structure that binds with specific target antigen. That concludes our chapter 7. Thank you very much, and